debate on reflection, I guess, tonight has been, albeit valid conversation, has been ideologically based in a lot of instances. I represent people out of Glenorchy who don't have the opportunity to debate those sort of topics a lot because they're worried about practical issues. We have a lower level of income, we have poorer health outcomes, we have people who are more predisposed to mental health issues.
And you have more gaming machines than anywhere else.
What are each of you, on a practical level, going to do to the people, for the people that I represent and care about?
I'll kick that off. That's a big question, needing long-winded answers, so I'll try and be brief. One of the big issues that I've encountered in my campaign is the issue of pensions. Unfortunately, all our pensions and government payments, federal government payments, have fallen further and further behind the real cost of living, so that now many people really struggle to live to any sort of reasonable level on the pensions they're on, whether age pensions, disabled pensions, carers payments, single parents and so on. I think there's a compelling case for a one-off increase in all the government pensions and payments to get them back up to a level you can actually live on, and then get rid of the twice-yearly CPI adjustment, because I think the CPI adjustment doesn't accurately reflect the increase in cost of living for those people, because they have disproportionate amounts, say, power bills in their weekly budget. So I think that's something the next government needs to look seriously at. The issue of public education. There's a disproportionate number of people in the Glenorchy City Council area going to public schools, and I said it earlier at my start. The fact is that in Australia, because of a completely unfair funding model, the schools that educate 2/3 of our students only get 1/3 of the federal funding. It's said that as much as $7,000 a year goes to a child in an elite private school versus $1,000 a year in federal funding to a student in an average public high school. That's not good enough. It's unfair. This isn't about public school versus private school, although that's the way it often comes up in discussion. It's actually about need and the fact that the federal government should fund schools according to need. There are people out there tonight who are feeling desperately sick because of the state of their teeth, because they can't afford to go to a dentist. It is self-evident. I applaud the Greens for championing this issue for a long time now, and I support them on this. It is self-evident that dental care must be brought into Medicare. It is not good enough that 20% of all Australians will suffer an episode of mental illness this year, but yet our mental health services are so underrated. And the fact that we have people who are not being treated well. I met a family on the campaign trail recently, and I'll dumb this down so you can't work out who it is. All I'll say is their daughter, who suffered severe bipolar disorder for 25 years, threw herself off the Derwent Bridge in March, aged in her early 40s, because she could take it no longer. And when I look at those parents, and I talked to them over a cup of tea a couple of weeks ago, the sadness in their eyes would bring you to tears. And if only the politicians and the people that make our decisions could sit down with those people and hear their story about how they battled or they tried to care for their daughter as she battled severe bipolar for 25 years, never able to get the health care she desperately needed, and it drove her to suicide. It doesn't have to be that way. We are a rich country, we can do it better.
Jobs, Matthew. Jobs. You do it through industry. We get an injection of cash, because we'll be a marginal seat, the pork will come. We then get capital infrastructure, we create jobs. From jobs, we create wealth of individuals. Individuals have wealth, they can put their kids into school, they can pay for their teeth, they can pay for a doctor, they can get good education, and they can feed their family. It is about, and also they will pull on and demand skills and jobs. So you will need the necessary office managers and accountants and salespeople and electricians and plumbers.
And you pay for the bill as well. If you pay how you pay, you probably wouldn't have to talk about giving them special deals to get go back to work. I mean, it's
But it is through the creation of jobs that creates wealth, and with that comes hope for the community, and with that the city of Glenorchy, the great city of Glenorchy, expands and grows, and the community grows in itself because there is an injection of money within that community where the people can do things that they wish to do, and we celebrate the spirit of the individual growing and moving amongst their own community.
Thanks, Cameron.
What will I do for the people of the city of Glenorchy? Greens policy is very clear, but as Andrew alluded to, the Greens have been a strong advocate for bringing dental care into Medicare. As a health practitioner, it's obscene that the teeth haven't been included in Medicare, and yet as an emergency medicine specialist at the Royal Hobart, I see so many problems related to poor dentition. And it's cost shifting, but it would be cost effective to just create item numbers and let's create a national dental scheme. And we know how to do it, all the work's been done, only the Greens have the political will to make it happen. Primary care, I've had a beer with Graham Alexander around Claremont a couple of weeks ago, talked about the issues, about health. His biggest frustration is the constipation in the health system, that he spends so much time just trying to get things done, which should be easily done, but aren't because the system is clogged. And health reform is what that's all about. And simply building infrastructure in the form of new buildings or super clinics isn't the answer. It's true health reform. And by having someone in Parliament who knows what questions to ask, backed by the principle that our public health system should be the one that sets the standard, will make a difference on the ground at Glenorchy. Having the principle that our public education system should be the best, against which everything else is measured, will make a huge difference. A child in Glenorchy, Claremont, Bridgewater, in a classroom should be having exactly the same experience as a child in the greatest private school in Sandy Bay. I'm taking the more education approach. No, I'm aware it was in Franklin before it was in Lawrence. So no, that's what I'll do for Glenorchy.
Thank you. Mel.
Yeah, I wouldn't describe the discussion that we're having this evening as ideological, because I think that people in Glenorchy and the northern suburbs care just as much about the environment, about a humane approach to refugees, about all these issues as much as people in Hobart. I think that the policies that the Socialist Alliance has would benefit people in Glenorchy immensely. I think that, we are advocating for a massive funding boost in public transport. We want to see, buses running so that you can catch a bus whenever you need to. We want to see massive funding boost in health, in education. These things are human rights. And we think that, the wealthy society should be going towards these things, and they should be, of a very high quality. But I think that things like, having a healthy environment, that's important for everybody, but particularly people who come from, low socioeconomic backgrounds, who live in poorer suburbs. I think that they benefit from these things more than anybody, because I think that they're the ones who bear the brunt of a society. Migrants bear the brunt of attacks on them when we have two major parties who are scapegoating refugees. So I think that these issues that we're talking about are important for everybody.
Thanks, Mel. Jonathan.